With Omicron spreading, the holidays approaching, and appointments booking up, people are heading to the few walk-in testing sites like this one, though some already know they'll test positive.
Those plans are canceled for Christmas this year. Staying home, yeah. I already did a rapid test, so this is just to confirm it.
PCR tests are considered the gold standard for detecting a coronavirus infection, but the wait for appointments and test results is getting longer.
We're not at our full capacity yet, but we want to keep some of it for outbreak management and long-term care facilities, etc.
Thank you very much. Have a good day.
That's why people are scooping up take-home rapid antigen tests, and supplies are running out. Some local health units are using them as an alternative to PCR tests. The rest of Ontario may follow.
Even when it's not the gold standard, if it's positive, take it seriously, act just like you would if you got a positive PCR test, isolate, notify others, and of course, monitor your own symptoms.
But for those who get a positive result on a rapid test,
the struggle has really been to get a PCR result, which Toronto Public Health says you should get within 48 hours, but trying to do that has been next to impossible.
with more people expected to rely on take-home tests and the Omicron variant spreading so quickly, experts say accurate case counts no longer seem possible. But at this stage, that may not be a priority.
If you can enable people to do this themselves at home, that's a huge win.
Still, to know for sure, some are willing to wait. Vic Adopia, CBC News, Toronto.
So let's talk a little bit more about the delays with these really important PCR tests. Dr. Zain Chagla joins us now. Dr. Chagla, what kind of rethink do you think we should be doing about who gets these tests and when?
Yeah, I mean, ideally, if we had unlimited tests, we give them to everyone. But the reality is we have to identify people who are at the highest risk of transmitting into vulnerable people or those vulnerable people themselves. And so looking at symptomatic people above a particular age with particular medical conditions, and looking at people who work in sectors with those individuals. So those who work in healthcare and long-term care and other vulnerable sectors, getting their test as a priority. And less focus on asymptomatic contacts where they may not need the testing and can isolate without necessarily changing public health behavior.
And interestingly too, we've heard you say that we can no longer use case counts as a way of determining where we are in the pandemic. I'm curious as to why that is and what we should be looking at instead.
Yeah, I mean, if we're rationing PCR tests, then, again, you can't use case counts because not everyone is coming forward to get tested. And so you don't have a great guide of what's going on in your community. Hospitalizations are not a bad measure. But again, as the numbers increase, the number of people in hospital with COVID, not because of COVID, is also going to increase. And so I think we look at ICUs, we look at hospitalizations where they need oxygen. And those are going to probably be the guide of what's going on in our community and what this impacts on our healthcare system.